So let's talk about sodium. So sodium is responsible for fluid regulation, nerve communication, muscle function, and overall electrolyte balance. So my advice is to think about the brain when it comes to sodium. So for hyponatremia, that is a sodium less than 135. So hyponatremia, it causes the brain cells to swell, and that then will impair brain function. So that's why you will see signs and symptoms of confusion and seizures. You also will see muscle weakness in this patient. So what are some causes of hyponatremia? So fluid overload. So let's think about this. So we know that salt follows water, right? We remember osmosis. So when we have a bunch of water, it can then dilute the salt. So that can cause your sodium level to be low. Syndrome of inappropriate antidiuretic hormone, that causes water retention, which dilutes your sodium levels, while your diuretics increase your urine output, leading to sodium loss through your kidneys. Now, what are we going to do to treat this? So your patient may be on a fluid restriction to restrict the amount of fluid so it's not diluting the sodium. And then you can also give your patient hypertonic saline. So that is in severe cases, and that will be done in the ICU. Hypernatremia is a sodium greater than 145. So with hypernatremia, you have a bunch of salt. So symptoms will be thirst. So remember, salt follows water. So if you have a bunch of salt, your body is going to be super thirsty looking for water. You're also going to have dry mucous membrane because of that need for water. You're going to have restlessness, and you also can have seizures. So guys, remember that with sodium, it controls nerve communication. So that's why you will see restlessness and seizures. So being that these patients are at risk for seizures, whether their sodium is high or low, we want to make sure that we implement seizure precautions for these patients. Okay, so we want to make sure that we have the bed in the lowest position. We want to make sure that we have the padded side rails. We want to make sure that that if the patient does start seizing, that we turn them on their side and put nothing in their mouth. So we want to make sure that we implement seizure precautions. What could be some reasons that cause hypernatremia? Dehydration. So that patient is not taking in enough fluids, right? So that salt then is super concentrated, right? Because there's not enough fluids there. If your patient has diabetes insipidus, so with diabetes insipidus, it is caused by the impairing of the kidney's ability to concentrate urine. So that leads to excessive water loss and dehydration, so which could cause the sodium levels to be increased. So treatment could be fluids, whether it is oral fluids or IV fluids, and then treat the underlying cause. So if the underlying cause is dehydration, treat that. If the underlying cause is diabetes insipidus, then we want to treat that. So you guys, we went over sodium. So it is important to know that when it comes to sodium, brain function is going to be priority. So we are going to see changes in that patient's mental status. Really quick, want to talk about hypertonic solutions. What do hypertonic solutions do? Basically, they cause water to flow out the cell, which leads to dehydration of the cell. So you guys, this is so important when it comes to correcting sodium imbalances, that we don't do it so fast. Hypotonic solutions, they cause water to rush in the cell, and this can lead to the cell swelling. And like I said early, in severe cases, these are done in the ICU. And that's a wrap. I hope you guys have a better understanding of sodium imbalances. Thanks for